right, thanks for coming to this session this morning called Imaging the Moving Brain. Great to see a critical mass this morning at the conference. Now, this session is going to be chaired by Valentina Pasella, and in the program it says Tianzi, but obviously I'm not Tianzi, I'm Stephanie Forkel. And I'm happy to get us started right away with the first talk. That is Imaging the Brain During Coughing, a unique PET study by Yasuomi Ouchi. Please.
Thank you for introduction. And my name is Yasuomi, and this study is mainly performed mainly by Takafumi, the second author in this presentation, but he is not available due to his work, so I'm here for him as a supervisor of him. So actually, this session is imaging the moving brain. So our title is just loyal to this theme of this session, oral session. Okay, so I'm glad now we are in post-COVID era because the cough is a matter of something to avoid at that time. So I can say that now speak loudly about the cough. You know that the coughing is a protective reflex that protects the airway from harmful substances and needs to maintain normal airway open. So the three phases exist: the inspiration and the glottal closure and the forced expiratory effort, and glottal opening and the expiration. The three phases. And the two types of the coughs are acknowledged, and volunteer cough and induced cough. Induced cough is induced many types of substances, but we are doctors, I'm also a doctor, and we use often in the clinical setting the cough reflex tests to screen for the dysphagia, the difficulty swallowing using the capsaicin or other citric acid or the tartaric acid. So we often use the tartaric acid, and the mouse's movement is sluggish. So the tartaric acid is a white crystalline organics that occurs mainly in plants, notably most notably in grapes. So the tartaric acid, this candidate is easily cough. So we use okay. So the groups of the Professor Mazon in Melbourne did a series of great job using about the cough using the fMRI. So they used the model-based fMRI, and they reported the volunteer cough and the induced cough. They used the capsaicin. It's a kind of component in the chili pepper. So and also they reported the cough suppression. So that such cough induced many types of the brain regions, like the right figure show that they reported. So the many regions in the cerebellum, region and cerebellum are activated. And a close look at the brainstem, the masking the outside the regions outside the brainstem. So they reported that the cough induction are related to the nuclei in the brainstem, solitary and trigeminal, and the trigeminal nuclei are important in cough induction, they reported. But still, that they use the MRI. You know that the MRI, you need a fixation of the head of the volunteers. So of course, the PET and the MRI are the merits and demerits, but I can say that these two systems has a merit in looking at the deeper brain regions. So that's why our concern is maybe looking at the deeper side in the brainstem or the thalamus, and so we have to use the MRI or a PET, but still, as I said earlier, that the MRI use the fixation of the head. So using this, the purpose of this study is to evaluate the brain activities during the moving head, during the coughing in normal subjects, and using of course, the restraint-free PET system. So this is the first generation of the PET system. So of course, we developed the second version of the PET system. In the first generations, we need a cap. The LED markers are attached on, and the IBS camera that detects the LED movements. So that the camera was equipped at the back of the gantry here, like here. But there's the second generation. There's no more. We need no caps and LED markers anymore. And the camera is built in the gantry, and the camera detects the 4 points of the markers on the face. So that the volunteers are totally free of such masks and markers. So that we using the Courtney algorithm, so we skip this one. The PET data was collected the wrist mode, and the movement detected every 4 milliseconds. And they're using this algorithm. So skip in detail. If you're interested, please refer to our previous reports in 3 years ago. And in this study that you know that we use the dynamic measurement after injection of these tracers, so that you can see that the time activity curve is collapsed after 20 minutes after injection, but this algorithm clearly corrects the time activity curve like here. So as you can see, the left side, there's no motion correction. You can see the blurred images, but this algorithm corrects the X, Y, Z and rotation and nothing like here. So using this machine, we study the cough, the physiology. So the volunteers are lying down reclining on the bed, like here. So we are in the mask, as I said earlier, the LED, and we are the mask that the titaric acid vapors are passed through this tube. And the merit of the PET is low resolution of the time resolution, sorry. Time resolution is so low compared to the fMRI, so that we use the 60 seconds data collection. And next tasks should be started 10 minutes after. So this is the demerit of using the PET as a low resolution of time resolution. So the task was the counterbalance like this. And the number of cough is voluntary cough is higher than the induced cough like this. So that this is a scene of tartaric acid induction. So that you can see that now that the tartaric acid vapors are passed and the volunteers cough induced. And the 20 seconds, the vapors are inhaled, and 10 seconds off, and the next vapors comes and this cough. So during this movement, we collected the data. So this is a spirometer that you know that the inspiration curve and the expiration curves. And if you cough voluntarily, the cough peaks like this appears. And the induced cough, the cough at randomly occurs. But suppressed, the cough, there's no cough peaks. Of course, the cough is prohibited in this, during this period. So the results show that the volunteer cough, compared to the resting state, the volunteer cough that activates the cerebral vermis and the cerebral lateral side of the cerebellum. And the induced cough, the pons and the medulla and the cerebral vermis also activated. So looking at the complex cough suppression versus resting, you can see more brain regions activated in the cerebellum, like here, cingulate, insular also. So the next comparison is induced versus voluntary cough. So you can see that the induced cough activates the thalamus, pons, and the medulla like this. And of course, the induced cough versus suppressed, the similar but more regions activated. And this is roughly the regions activated. And the tartaric acid effect, I want to see that the regions activated by the tartaric acid. You can see these tartaric acid use and the no use that we compare the two. So the thalamus, pons, and these regions are activated. And interestingly, that the pons are, of course, are activated using the tartaric acid, but there's no, this is a higher agitated cough, that the stronger activation is disappeared compared to the low agitated cough, meaning that the pons may not directly related to the internal emotional changes. So this is a scheme of the time of past, the hypothesized scheme brains networks like here. So there's no time to explain. So the volunteer cough like this, and in this cough like this, and the cough. And so the last slide is, so to conclude, our unconstrained PET system provides excellent depiction of the brain activation during head movement. The cerebellum plays a role in regulation of cough, not only through motor coordination, but also through the personal perceptual control of cough. The brainstem is especially involved in the manipulation of cough. So I skipped the future outlook. Thank you very much for your listening. Sorry.
Thank you, Uchi. Unfortunately, we went too long, so there is no time for questions. But I encourage you to reach out to Uchi after the session. Thank you.
Thank you so much.